Dr. Anthony Robert Charles, I'm the Chief Surgeon at Rainbow Children's Hospital. So this 7-month-old baby came to us from Sudan after being operated there during the newborn baby period. Basically has a condition called extrophy, which means the bladder is outside instead of inside the body. Therefore the urine is leaking continuously, every second urine is leaking, and all the bladder flesh is outside and the birth canal is facing outside, open. So this is a condition which we cannot continue, for the quality of life will be very poor. So
why this condition will appear, sir?
Yeah, so this is a very rare birth defect. It's a defect of nature. It comes in once in 50,000 girl babies will have. It's an extremely rare thing.
Is it hereditary?
It is not hereditary, and this is not usually connected to any other system which is wrong. So these babies otherwise have a healthy mind, a healthy life they will have. This is the only external defect which is there. Yeah. So then we've closed the bladder now and repaired the muscles, sphincters for control, and we have displaced again all the private parts to go, the genitals to go downwards, and we have closed the hip bone with the help of the orthopedic team, Dr. Girish and Dr. Jayant here. So that is what we have done now. It is now more than 2 weeks since the surgery. It has healed very well, which is why we wanted to talk about it now. And we will see the child again after 2 to 3 years. The basic message we wanted to give out from the conference is, although this is a rare condition, there are other rare conditions, it is possible to correct it and to give hope to families who have this kind of troubles.
This bladder extrophy, so what are the symptoms, sir?
Yeah, so as soon as the baby is born, it will be obvious that there is a red fleshy mass between in front of the hip. Where the urine bladder is normally closed for us, it will be open. Their genitals also will be split open. It is called an open book. Everything will be open. You will see it, and urine you will see dripping from the tummy wall.
So you told out of 50,000, so one
baby
may occur like that. So are there any specific reasons for this?
For this
with
to
respect
happen?
to
No.
the health of the father, mother, or
Nothing. These are what is called sporadic. So they just come in the population at that frequency. It comes. It's nothing related to genetics or what the mother or the father has done during the.
what type of surgery you have done, sir?
Yeah. So this is a reconstructive surgery where we do it in many steps. First level we close the bladder, then we close the muscles, the second layer, then the bone is closed on top of that. So it's a reconstruction at different levels. So it's a reconstructive surgery.
And in the what age group this will happen?
As soon as the baby is born, because this is something which is there only in babies who are born, then it has to be repaired. Unfortunately, there are children in India where parents are not able to take them to the hospital, and even at 8 years we see them leaking urine, not able to go to school, sitting in the house, smelling of urine. So those are the children we need to attract and correct it for them. Because once this is corrected, the rest of their life is normal.
So from the Rainbow Children's Hospital, Whitefield, this is the first of its kind.
In the
case.
Marothalli branch, this is the first one. We've been here for this is our second year. This is our first one in this hospital.
So in India also, in the children's, are there any cases?
Yes, there
like
are
this?
cases. Especially you'll see it in the big referral teaching hospitals like AIMS or St. John's or Narayana. These referral hospitals is where this will go. Each surgeon in his lifetime generally will see about 3 or 4. It is that rare. It is not something which you will see every year.
What is the success and survival rate of these children who have got the surgery?
Survival rate is the same as anybody else because this is the only organ which is touched. Otherwise, they have the same life expectancy as you and me. In terms of success, about 30% of them, when they are operated early, in the right age, in the right team, they will have a normal life. That is around 30%. The remaining 70, like this one, where it is broken down, will need repeated repairs, maybe 2 repairs or 3 repairs. The main problem they may still have is the bladder may be still small, and at some point we may need to make the bladder big. But as a girl, in terms of her getting married and having children, all that will be fine. The only problem will be with the bladder.
Now, since this will happen in the just born babies, so are there any infectious diseases? So going
Not very
later
different.
stage like that.
Not very different.
It will not.
That 8-year-old child I was telling you, where the bladder is exposed outside for many years, they might develop a cancer of the bladder because it is exposed to the environment outside. But that is a long-term complication for somebody who is not closed. But this one we have closed it, so that should not be.
I'm Dr. Girish. I'm with the Pediatric Orthopedic Services at Rainbow Children's Hospital. Working as a team here, we were actually involved in mobilizing the pelvis, which is actually open, so that the closure of the bony wall as well as reconstruction of the bony wall and closure of the skin becomes adequate. So that is how we got involved into this. It's a very rare surgery that has been performed, but as a routine we do it for other conditions, but as a pelvic osteotomy here it is a very rare. This will not have any impact on the child's walking abilities or sports or any other activities, as most of it will be remaining normal. It's only the pelvic wall which is got reconstructed.